Hi, and welcome to the Art of Transitions. It's really a pleasure to be with you today, and our guest is Dr. Gregory Kraft. He is actually the owner and director of Kraft Chiropractic, and he's going to open our series today on chiropractic history and moving beyond. So when you come back, join us in just a moment, and we'll be going further with chiropractic services and beyond. Welcome back to the Art of Transitions. I'm Gwen Marchon-Mazza, and it's my pleasure to be hosting this show once again. Our guest today is Dr. Gregory Kraft. Thank you for joining us today, Greg.
Oh, you're welcome.
Greg is going to talk with us about chiropractic history so that we can invite the community to know about services that extend beyond traditional Western services. We've brought other shows such as acupuncture and massage therapy here before, and I've had a chance to work with Greg and his team and get to know them, and I thought it might be really important for us in this Rochester community to get to know other kinds of services that we have to relieve pain that might involve things that would be a little different than traditional medication and services. So thank you. Greg, tell me a little bit about your interest in going into the chiropractic world, and a little bit about your training, and a little bit about the organization that you are developing here in Rochester.
Okay. Well, I got interested, I kind of got interested in chiropractic genetically. My father was a chiropractor. My grandfather was actually a chiropractor as well. So okay. I'm one of only 2 third-generation chiropractors in the Rochester area. And so I grew up with it. I actually never really had a medical doctor. Most of my health care as a kid was taken care of by my father and other chiropractors. And as I got into looking into what I would do with my life, it was one of the things that I looked at. I did make a point of kind of looking at other options because I didn't want to just be following a path of least resistance. And I have to say, I've never regretted the decision. I love what I do. I love what chiropractic can offer. And I've been doing this almost 30 years now, so it's been a lot of fun. Well,
it's interesting because I'm sure that folks in the community are familiar with chiropractic work and chiropractors. However, I'll bet there's folks in our audience who do not know exactly what chiropractor work really involves. Would you just take a moment and give a brief orientation for our viewing audience?
Yeah, certainly. Chiropractic is a healing art that is particularly focused on the alignment and the function of the spine and the nervous system. And the premise of it is that if there is a change or a problem in the alignment, the position, the movement, or the spacing of the spine, it can cause pain directly, which is the #1 thing that we treat. But it also affects all those nerves that come out of the spine and go out and control and regulate all the rest of the body. So our job essentially is to determine if there's a misalignment or a lack of movement in a joint, restore that to normal, remind the body of what normal is. When we do that, the body starts to recover and begin its own process of self-healing. So we're very effective with acute pain, chronic pain, etc.
It's interesting, you use the words remind the body. Can you elaborate a little bit about that? That's kind of fascinating.
Yeah, there's a term or a phrase in chiropractic, in kind of old-time chiropractic that's used. It's above, down, inside out, and as it relates to chiropractic and the nervous system is that it's really the brain and the spinal cord, that's the above, down, and then from the inside out. The body has its own innate intelligence regulated through the nervous system that controls all function, including healing in the body. And there's really no doctor in the world that ever cured anything. Our job is really to help the body release its healing potential. So if you take a medication, if you take an antibiotic, it kills some of the bugs. Enough so that the body can then get rid of the rest of them. The antibiotic never kills all the bugs. It just kills some of them. And so our job is, instead of trying to make the body do something, we work with the body to release that kind of natural healing capacity.
That is absolutely fascinating. When you look at chiropractic work and you look at its evolution, many times it didn't get the recognition that Western med received. And I know sometimes even in my work and as a therapist, sometimes that clinically that piece still, people kind of say, what is it really and how does it work? And it's not about being in competition with other parts. It's about supporting and being working with Western medication as it needs to. Can you talk a little bit?
Well, I like the term of working in concert.
Working
or,
in concert.
Or integrative, because in a concert in an orchestra or a band,
right.
You have many different instruments or voices, and they all have to work in harmony. Each has its place. The soprano can't sing bass, the tenor can't sing bass, the bass can't sing the other two. And so it has to all fit together. I think historically, that the big divide or the conflict, if you will, between kind of traditional medicine and chiropractic, there's a host of reasons for it, some of them being political, of course, but I think underneath it, I think at the individual practitioner level, the medical doctor and the chiropractor, both of whom care and want what's best for the patient, I think it really boiled down to initially chiropractic education not being that good.
Oh, okay.
And that has, and that's really, I mean, in the last 30 years, but definitely the last 20 years, the ramping up of chiropractic education has been amazing and totally different. Along with that is, I don't think either side, if you will, I hate that term, but either side had the vocabulary to be able to talk and discuss with each other. What I'm finding now, my generation of chiropractors, and frankly, there's now a new generation of chiropractors, which is like mind-boggling, are working very much hand in hand with medical doctors. I have colleagues who probably 80% of their new patients are direct medical referrals. There's one chiropractor in Rochester that's an adjunct faculty for U of R Medical Center. It's just, there's been a lot of change that way. I think from the general public point of view, I think chiropractic is now poised where dentistry was in the 50s.
Oh, okay.
And I'm a child born in the late 50s, a child of the 60s, if you will. And I remember that back then when I was a kid, people knew that dentistry was good for an acute cavity. If your mouth hurt, you went in. But they didn't really think about a lot going in just for wellness dentistry or dental hygiene. Also, people were afraid of dentists. The tools and the techniques that they had were not as good as they are now. They were afraid of it hurting, and frankly, it did hurt sometimes. Back in the late 50s, early 60s, dentistry began to educate the public on the effects of tartar and plaque on the teeth. That was those little red pills that we would chew. It would show us the things that you couldn't see and you couldn't feel.
Right.
And along with that, they started to educate people and develop their techniques and improve their things. And so nowadays, nobody thinks twice about going in every 3 months or 6 months or 9 months or 12 months and taking care of the things that they don't even know about, so that they don't have to have that high-powered drill coming at you.
Right.
Okay. Chiropractic's very similar. I think at this point, most people recognize that chiropractic can be very helpful for acute back pain. There's becoming more and more evidence of its impact on chronic pain. But I think still there's a lot of people that are still concerned that it will hurt, and there's a lot of people that don't understand that chiropractic wellness care, or spinal hygiene, if you will, to steal a phrase, can be beneficial in terms of preventing future problems or keeping problems to a minimum. And that's really what I think chiropractic at its best is really about.
In chiropractic, much like I'm very familiar with all other medical services, mental health services, there's an assessment and you're spending time with your patient in advance, and you're having great conversations to find out their history, because if it's anything like our work, it's individual.
Yes,
Each person's individual.
absolutely.
You may use some tools and techniques and processes. However, one shoe does not fit all. That's what I've experienced. Is
No.
that, would
No,
you
it
agree
really,
with that?
it really doesn't. I think in most offices and most everybody that I know, it all really starts with the history. The history, if you will, is the key to a good health future, is really finding out. The more we find out about you as a person, as your life, as your lifestyle, and typically in a chiropractic office, we'll spend a good chunk of that time finding out specifically what may be causing or aggravating the pain that brings you in. And we need to focus on that initially, but we do try to get a much broader health history as well, partly because chiropractic can help with some of those things in an indirect way sometimes, or some of the ancillary things that we can do. Just as, in fact, more importantly, we need to know where our boundaries are as well. In other words, part of our responsibility as a professional, as a doctor of chiropractic, is that's what our education is. It's as long as med school. Is to be able to not just recognize when we can help a person, but when we can't, and when something else may be necessary. So we have the history. We have an examination, which is everything from standard orthopedic type testing, ranges of motion, posture, palpation, and then there's a variety of other tools that are used in some offices, X-ray, but very few offices in Rochester do their own X-rays now. That's done mostly if it's needed. We very often go through the medical doctor to get that at an appropriate medical facility.
Excellent, excellent. As we talked about history a little bit, how long has chiropractic work been in existence? Where did it really start?
Chiropractic dates itself to 1895 in Davenport, Iowa, with Daniel David Palmer, D.D. Palmer, who was he was a healer. He was a kind of an alternative healer. And he was the one that began to hypothesize that the spine and nervous system could be connected to different things. So he began with a guy named Harvey Lillard, who was actually the janitor in his building, who had a health issue and had noticed it. They got talking one day and he noticed that it had happened after he had a fall and hurt his back. So he had back pain, and he was having some difficulty hearing, which was not like deafness of hearing. It wasn't. It had come on suddenly. It wasn't, the typical aging type of hearing loss. And so Palmer adjusted the back, and his back pain went away, and his hearing improved. And from there, it became a progressive story. That's chiropractic. Manipulation or adjusting of the spine, manual medicine. It's probably been around as long as people have had spines and hands. So
it really started at the beginning of time, as soon as we could figure out that.
Well, in my office, I have a print of some Chinese gentlemen doing a rather crude, but an adjustment of somebody's neck and of somebody's back. And the originals of that were from, they were printed or done, carved into tortoise shells, dated in like 2000 BC in China. And the acupuncture class that I took at, the guy had found those and had made them into, not found the shells, but found about them and had them printed up. And so I have a couple of those hanging in my office to remind me that it goes way back more, and it will go on way beyond my time.
Right, which is actually some of the other pieces we're talking about, chiropractic basics, and could you give our viewing audience kind of a list of services that chiropractic can impact, kind of illnesses that it's most successful in treating? And you had said back pain and other things, though.
I think the obviously pain is the predominant thing. The two things that most people come into a chiropractic office for are either some sort of pain or some sort of fatigue. Those
Oh,
are
okay.
by far and away the two most common things.
And they go hand in hand when you think
And
about it.
they very often go hand in hand, especially when we get either very acute or very chronic type of
Absolutely.
pain. So lower back pain, pain between the shoulder blades,
Okay.
neck pain, headaches,
Okay.
migraine headaches. We've had
Okay.
some really good results with that. Sciatic pain. So that's pain down the leg, especially if the pain goes into the leg but doesn't go past the knee.
Okay.
I know a lot of chiropractors, even patients that have a disc problem and that may need surgery. We can't always fix that, and sometimes people need surgery. I mean, that's wonderful. We have a really good neurosurgical community in Rochester. We are absolutely blessed with that, and a number of them refer to chiropractors almost as a pre-op type of thing, because in most chiropractors that I know, if somebody has a situation like that, we'll evaluate them. If we think it's safe to adjust them and to work with them, we'll usually give them a 2 to 3 week time frame. If we are really effective in that time frame, they'll be feeling a lot better. They may not need the surgery.
Okay.
If we're not, then we know pretty well that they do need the surgery, and they're better prepped for it. Because the reality is, it's pretty hard to hurt yourself bad enough that you need surgery without having chiropractic issues as well. Whereas you can have chiropractic issues and not have any need for surgery. So I kind of look at what I do as both therapeutic and sometimes diagnostic in terms of, oh, doc, do I really need to have that surgery? You know, I'm a little afraid of it. And I see that pretty regularly. I say, well, I don't know, and we'll try this. But what I can tell you is that if you do well, then you may not need the surgery. And if you don't do well, you'll be in better shape for the surgery.
Excellent. Excellent point.
Yeah. So those are the main things I think that chiropractic come in with. And then chiropractic is really based on holism or vitalism, as opposed to the mechanics of chiropractic tend to be what get advertised. But going all the way back to Dr. Palmer back in the 1890s, we really talked about the vitalism of chiropractic, and that the injuries to our spine are not even primary, but they result from stresses.
Okay.
And so ultimately, chiropractic is about helping people deal with the stress of life. And those stresses can be physical, they can be nutritional or biochemical, if you will, so toxicities or nutritional deficits or things along that line, and they can certainly be emotional / energetic. And so most chiropractors take a little bit more kind of holistic approach, and while some may focus, and where our primary focus is on the adjustment of the spine, which is more the physical stress, if you will, most of us do some form of nutritional advising or nutritional supplement advising. Many of us have a background in Chinese medicine or meridian therapy, laser therapy, which is cold laser therapy, which is becoming really, really popular across the board. The first profession to really take it on and adopt it and you go with it was chiropractic. I mean, I've been doing cold laser since 1995. It's really become popular since about 2005. I was about 10 years ahead of the curve.
With the chiropractic pieces and being ahead of that curve and having that information, can you help share with our audience what are some of those pieces? You've mentioned them by name. Could you kind of describe what the cold laser therapy is, how that works? And you in your world, you just kind of rattle it off because it's normal for you.
Yeah.
In my world, I have to slow it down a bit. So if you could give us some of the ideas around the cold laser therapy, what are some of the other?
I think let's start with cold laser therapy.
Let's start with that and do 2 or 3 of them.
There's a couple of ways that can be used.
Learn about that.
Yeah, cold laser is light therapy.
Okay.
Light is a form of energy. And so what they've discovered is that for years in not just chiropractic, but particularly in physical therapy, we've used electricity as a therapy, so like muscle stim, or sound waves like ultrasound. as a therapy. What they've now realized is that light can be a therapy. And when we shine a light, so it's a small handheld little thing that just sits, and we basically set it on the skin, shine the light on there for 30 seconds to,
Okay.
2 minutes, something in that range
Okay.
at each area. And it's a laser, so it's a very focused, very specific light. It's not just, you can't sit,
So it's not a light bulb.
Not a light bulb.
Okay.
It's an expensive light
laser.
bulb.
It's a very, very expensive, refined light
Yeah,
bulb.
it's a refined light bulb.
Okay.
The whole intent and function of it is to energize the tissue cells that the light does. So the light penetrates about that far, and
This far into
about an
the
inch,
skin?
about an inch.
Okay.
And so we can use it on a shoulder, we can use it on the spine, we can use it on a knee, we use it for tennis elbow, rotator cuff problems, sprained ankles. Hugely popular in the athletic injury field.
Okay.
Because it energizes the tissue cells so that they start healing faster. And so
okay.
what happens is, if you injure something and you need repair, the body starts an inflammatory process. And that's designed in order to get all the materials that are needed for repair to the job site. So it's like dumping a pile of bricks there to rebuild the wall.
Okay.
But if you don't,
okay.
exactly, but if you don't rebuild that wall fast, all those bricks just stay piled up there. So all that inflammation, that's why a sprained ankle gets swollen and hot and hurts. We use a cold laser on there, and we can use cold laser because it doesn't generate heat. So we're not going to injure it. That helps the tissues to repair faster so that the inflammation can go down and we can push through it. And so we get much, much faster healing on especially sprains and injuries like that.
Okay.
I treat a lot of athletes because both my kids are athletes, and so I've kind of gotten into that mode, and it's phenomenal for that. But it's also great for chronic problems, because when you get chronic back pain, that kind of naggy toothache pain, it never goes away, or it comes and goes. It's probably one of the more fatiguing, more debilitating conditions a person can have. Part of the problem is those cells that have been injured back there, the ligaments and the tendons that have been injured, can't quite get healed. And the cold laser energizes that so it can get beyond that for better healing.
That's incredible. To think about that
Oh.
this little laser of energy that's cold.
Yeah, the
can
technology
make a
of, cold because it doesn't heat.
Right,
Okay,
right,
it's not that
right.
it causes cold, but
No.
a hot laser is what they use for
Right.
eye surgery and cutting safes open and things like
Right,
that.
right.
But a cold laser does it with really no risk. I mean, there's just virtually nothing that you could do the cold laser over that would be problematic. I mean, the only thing we wouldn't do it over would be, like an active tumor cell or something like that, because we don't want that to grow more.
And generate,
I'm not convinced, there's no real research that it would be a problem, but nobody does it because we want to be safe with it.
Excellent.
And every NFL team has it now. I mean, it's an exploding technology in terms of its effectiveness.
And so chiropractic work really has introduced some of these newer models.
It's really brought a lot of that in play because we want to find ways to help people without being intrusive. We don't use drug, we don't use surgery. So we have to find every tool we can use to help that person be as functional and as healthy as possible.
How about one of the other tools? I know there's cupping and there's all these other things that I hear you talk about, and I find fascinating.
Well, my background, not all chiropractors do this. Well, they do, but some don't do it intentionally. My background is also in Chinese medicine. Okay. I was trained in school, and I've had a bunch of I did some training in Germany. And I find that meridian therapy or traditional Chinese medicine blends very well with chiropractic. In fact, I believe it's one of the reasons that chiropractic is as effective as it is, because there's a series of acupressure points that go right down along each side of the spine. And so when we're adjusting the spine to improve joint function and to improve nervous system function, we are also impacting those acupuncture meridians. And I think that that's kind of a hidden or kind of an unconscious for a lot of chiropractor reason for why it helps. Although myself and a number of my colleagues also directly use meridian therapy. We'll use the cold laser to stimulate acupressure points.
Okay.
We'll use Chinese herbals. We'll use cupping sometimes.
Now, what is cupping?
Not too many people do cupping, but cupping is a Chinese medicine technique where you can either use it's a glass like suction cup, if you will.
Okay.
And you can use it. Some of them have like a rubber ball that you press it in, and when you put it on, you let go, and it kind of sticks on, kind of like those old 1950s arrows,
Okay.
Right there.
Yes, they were later than that too, because my brothers used to use
the more traditional
those
ones,
with
and
me.
the ones that an acupuncturist, for instance, are more likely to use, are just a glass dome,
Right.
and you heat the air up inside. You put a little
Okay.
flame in there
Okay.
and put it on, and then that cools right off. And when it cools, the air
Creates a
contracts
suction, right.
and causes a suction, and that brings blood in. The theory is that it brings blood and energy to the area for healing.
That is incredible. Any other kinds of movements that your group is using and your colleagues are using in the chiropractic world that aids in the results for chiropractic work?
Yeah, I think there's two. Well, there's one big movement and one big tool that we do as much or more than anybody else. The movement is chiropractic from day one has been based on the new kind of throw out word is the psychosocial model for healthcare. And what that means is that we need to move away from doctor on pillar, treating patient gets well. We need to move to how is a person's lifestyle impacting their health. I think in today's time, especially with having the election and the Affordability Healthcare Act and all this stuff, I think it's a very important issue because ultimately, independent of the politics or the mechanisms of how we do health insurance and health care in this country, ultimately the only way we're going to truly drive down costs and drive down all the burden on society is to begin to start staying healthier. I think the dentists, again, I go back to that model.
Preventive medicine.
I go back to that model. They were the first ones to really, really promote it. And that is that, and most of us know this, the more we do to keep our teeth healthier, the less that we need to do, have them do, which means it's less cost overall.
Doesn't mean there won't be any cost, it means it will be less cost.
Less cost, because you still need to periodically go in, and you know what? Bad things happen to good people. You do everything right, and you can still get hit by a car.
Right.
Okay, or have cancer, or whatever.
Or in the dental model, break a tooth.
Break a tooth.
Right.
Yep. Exactly.
Right, exactly.
So I think that chiropractors have really always been focused on that, and we're kind of known. Once people get into our office, I think one of the things that they're most amazed at is the humanity and the human aspect of a chiropractic office, because we spend a lot of time with patients. We spend a lot of time talking with patients. We spend a lot of time finding out what's going on with patients and really getting to know them and helping them find ways that they can live a more vibrant, healthier, energetic, enjoyable life.
Thank you. Thank you.
The tool that goes with that is looking at nutrition.
And actually, that may be a whole nother series in itself. As you know, as you and I have chatted before, there's a whole market for that. What I would like to do is I would like to thank you so very, very much, because this has gone very quickly. I know it sounds kind of silly, but it goes very fast when we share with our viewing audience different opportunities they have. And I want to thank you for continuing to educate me on the gifts of chiropractic work. I would like to invite our audience, if you have other questions for Dr. Kraft or you would like more information, you're always welcome to reach him through me and our website. And we are going to spend more time with Dr. Kraft in another series, in another show, where we're going to look at the view of the new chiropractic model of treatment, which is going to be aired at a later date in another show. But on that note, we're going to close off the history of chiropractic and beyond. And again, thank you so much for coming.
Oh, you're so welcome.
It's great. Thank you.